Good afternoon, everybody, and welcome to this webinar in the series of CHF talks. Today we're going to talk about digital inclusion. My name's Jo Root. I'm the Policy Director for CHF. Some of you were probably expecting Leanne Wells, our CEO, but Leanne has to deal with a family issue today, so is unable to be here. First of all, I'd like to acknowledge the traditional owners of country throughout Australia and recognise their continuing connection to land, waters and community. I'm on the land of the Ngunnawal and Ngambri people, and I pay my respects to them and their culture, and to elders both past, present, and to any other First Nations people attending the webinar. When we're talking about access to services and measures to promote inclusion, we must always remember the gap in health outcomes between First Nations peoples and others, and recommit to our effort to ensure the gap is closed. So I'm sure you all will just take a moment to think about the lands that you're on. And we've got four presenters today, sorry. We've got three people from the Good Things Foundation, and then we've got Sonia Markov, who is a consumer, who's going to talk. We're going to start with Helen Milner, OBE, who is the Group CEO of Good Things UK, and she will talk about the activities of the Good Things Foundation to support digital inclusion and digital health literacy. And so, and after that, Jess Wilson, who is the CEO for Good Things Foundation in Australia, will talk about the way that Good Things Foundation Australia supports digital inclusion and digital health literacy. And then we'll go to Liz Jones, who is going to talk about a particular project, the Australia Health My Way program. So Jess, I think you're going to share some slides, and then over to you, Helen.
I am, so I will share.
Thank you so much, Jo. It's lovely to be here. As Jo said, I'm the Group Chief Executive of Good Things Foundation, and the majority of the time I'm spent in the UK, so I'm going to be giving you a perspective from the UK. So our vision is a world where everyone benefits from digital, and globally in the last 10, 11 years, we've helped over 4 million people to cross that digital divide and have a better life through digital. We're a digital inclusion charity, but that doesn't mean that we're interested in technology. We're very much interested in people. So our model is that we work with thousands of local community organisations right across the UK and right across Australia, and Jess will tell you more about that later. And then we help those people who need support in that local community because they're excluded from the digital world, to get digital skills, to be digitally able, to feel equal in a digital society, and to feel safe online. But the purpose of that is for them to have better lives so that they're happier, healthier and better off. And obviously today we're focused on people being healthier. So I'm going to focus on some work we did with the NHS called the Widening Digital Participation Programme.
Sorry.
Just decided to go backwards, don't worry about it. That we worked with the NHS over a 6-year period. Finishing, ironically, just as COVID was striking in March 2020. I'm going to talk a bit more about phase 2, but I just wanted to give you some of the numbers from phase 1. So over that 3-year period, we reached over 380,000 people, trained over 220,000 people, and trained over 8,000 digital mentors. There's a lot of really excellent outcomes on our website if you want to read more about that. But one of the things that I really hold on to from that phase 1 was that we did an economic benefits analysis. And in the 3rd year of that programme, that at least £6 million was saved by people who were digitally excluded, who didn't have the skills to use the internet and didn't have digital health literacy, then moving from an expensive NHS channel like accidents and emergency to going to see the doctor, or from the doctor to go to see the pharmacy. So this isn't just about moving everything from face-to-face to online. This is also about helping people to understand the appropriate channels, and that saved at least £6 million in that year. So phase 2 of the programme, we wanted to do some deep diving into some specific conditions. So we ran 23 locally led pathfinders. And obviously we have these 5,000 partners right across the UK, but we also brought in new partners, in particular in the professional health sector, because that was something that had been missing in phase 1 of our programme. So we did locally led pathfinders around particular illnesses like dementia or cancer, or particular groups of people like refugees, older people, gypsy and traveller communities, and young people mental health. About halfway through this programme, we decided that we wanted to make sure that we were synthesising the common elements, and we created 5 Pathfinder programmes. 5 of those Pathfinders helped us to evolve a model called digital health hubs. You can see from this slide that that we still continue to support people with digital health literacy through our what we have in the UK is an online learning platform, very much like Be Connected in Australia, but this is for all ages of adults, so everybody 18 plus, and we supported over 50,000 people through digital health literacy. So as I said, we evolved this model of a digital health hub. So what is a digital health hub? So I don't know, I'm sure many of you are aware of social prescribing. I love social prescribing, but I feel it's very one way. It's where your doctor says it would be great for you to join a walking club, and you go along to the walking club, and that helps you to improve your health and well-being. Whereas a digital health hub is about creating that bond and bridge, both from the community-led health sector. So that could be a community centre doing digital inclusion, bonding and bridging with the formal health system, GPs and other primary health professionals, providing that trusted support in community, going to where the people are, and also recognising peer support. And one thing in the UK, it always sounds like the NHS thinks that they own health, whereas actually when we're working in communities with people who are supporting well-being, then we recognise how much support there is within the community. So we've now expanded that to add another 15 digital health hubs across the UK. So just a couple of findings from that second phase of widening digital health participation. 2 of the big findings that came from our evaluation was that strategies to improve digital health literacy actually were seen as important for reducing health inequalities. People who are digitally excluded are typically older, on low incomes, have low educational attainment, and or are people with disabilities. And so they already are experiencing some form of health inequalities, but improving digital health literacy can actually reduce those health inequalities. And also we found that digital has become a social determinant of health, and that is something that is now recognised by the NHS. So I wanted to say something briefly about COVID. So the next slide shows something that we've just published in the UK about the impact of health inequalities and digital exclusion during COVID. That, as you can see on the slide there, 17% of over 65 said they lacked a suitable device to download a COVID-19 contact tracing app. 66% of adults had never used the internet to manage their health before the pandemic. And before the pandemic, only 19% of people booked GP appointments online. And that has massively shifted due to a lot of the work that we've all been doing and many, many other people have been doing during the pandemic, which obviously, I know you're having it hard at the moment in many places in Australia, but in the UK, it has been pretty terrible. And so one of the big findings from this report is that digital exclusion in a digital world is a health inequality challenge. It reflects, creates and compounds health and wider inequalities, but there is no single or silver bullet solution. And I think the things that myself, Jess and Liz are going to talk to you about are some solutions that definitely should be part of a patchwork. And just to finish, I wanted to very quickly tell you about two people that we've helped during the pandemic. Annette had the COPD, also had significant depression, and she told us that at the beginning of the pandemic, she was so excluded, and including digitally excluded, that she went to bed for 3 days and didn't get up, and sometimes wished that she didn't wake up in the morning. She was supported by one of our local community partners, given a free tablet. We've now supported over 22,000 people with a free tablet, free mobile data connectivity, and that really important, that community support. So that she says that it saved her life. Mabel's story, slightly different. Mabel also had a whole range of different medical issues. She also was isolated and digitally excluded during the pandemic, and she was given support by her local community partner of Good Things Foundation. And Mabel talked a lot about connecting with her daughter in Australia, in Canberra no less, where she hadn't seen her face to face for 25 years, which was amazing. But what happened there was that Mabel's doctor, her GP, phoned the local community centre and said to them, what you have done for Mabel by including her in a digital world, I failed to do with all of my many years of medical intervention. So I just thought I'd finish with those two stories, and I know we're going to have questions later. I'll pass on to Jess.
Yeah, Jess, before you start, I should, because I'm obviously not on top of things this morning, I should have said that if people have questions, they should put them in the Q&A box at the bottom of the screen, and we'll take all the questions at the end. So we'll go through the presentations and we'll take questions. And I know some people have sent questions in already, and we'll try to cover those. So if you just put your questions in, we'll try and deal with them. Okay, sorry, Jess, over to you.
No problem at all, Jo. And thanks for having us here today. It's lovely to be on a panel with my colleagues. I don't often get to present at the same time as Helen because we're in different time zones. So it's lovely to be here today. So thank you. I'm coming to you today from Darug and Gurungurra country in the beautiful Blue Mountains. So I'd just like to acknowledge to the traditional owners of the land in which I'm coming from, and pay my respects to the elders past, present and emerging from here as well. So look, Helen's already talked to you a little bit about the Good Things Foundation model. We've been here in Australia for 4 years now, and like our colleagues in the UK, as a group, we have the same vision, which is a world where everyone benefits from digital. And in Australia, we have the same model as well, where we've built a network of community partners. We're very passionate about working in partnership and building capacity in the community sector to be able to respond to digital inclusion. We create and co-design resources and programs that support digital inclusion, and we advocate for change. So we are always talking about hearing the stories, as Helen was just talking about Mabel and Annette, hearing the stories from the ground and being able to share those so that we're able to make change and get people to really pay attention to the issues around digital inclusion for people in the community, which I know Consumers Health Forum does incredibly well as well. So now I'm just going to have to change. We believe that everyone in Australia deserves the right to have access to affordable technology and the confidence and skills to be able to use it. And I suppose that's the thing about digital inclusion, is that there's 3 key parts to it, really. There's affordability, there's access, and there's ability. And the space that we're really interested in, and the work that we do is around building people's skills and confidence, so that ability space. But most recently, and just in the last 4 weeks, we've released this new report because we know that digital inclusion has become an issue because of COVID. COVID has exacerbated or highlighted, I suppose, the issues of digital inclusion or digital exclusion in Australia. And over 70 different reports have been released around digital skills and use of technology over the last period of time. So we wanted to bring those together. And this is our Digital Nation Australia landscape diagram that we have, and it's part of that report. And it's really about highlighting those people in Australia that are missing out and who are more likely to be digitally excluded. Now, what we know from COVID, as you can see in this little top up here in the little light green sign, is that actually COVID meant that we went from 10% of people never using the internet to only 1% of people never using the internet last year. Now, that's one report, that has suggested that. But what that doesn't show is actually that, using the internet once because you've had to sign into something because you're going to a cafe and you want to use a phone to get into the cafe with a QR code does not mean that you're digitally included. And we know that there's a significant number of people who might be able to do one thing, might have a smartphone, but are not able to do all of the things that they need to do to fully participate in the community. So what you can see is the people at most at risk of digital exclusion, people on low incomes, people with disabilities, people with a mobile-only connection. So a third of low-income families with school-aged children are likely to have only a mobile connection, and you can imagine trying to do homeschooling with only a mobile connection is a very difficult thing. People over 65 are more likely to be digitally excluded, and 80% of them find it difficult to keep up with technological changes. And in fact, less than 40% of Australians feel confident that they can stay in touch with what's happening with technology today, so that they can keep up with technology. So although people are starting to use more technology, they're not feeling confident to be able to do that. And there's the bridge to the digital divide of those three things I talked about: the affordability, ability, and access. Oh, hang on. There we go. So as I said, the impact of the pandemic has been that more people are using it, but 40% of people are feeling not confident. We also know that half of low-income households with home internet had difficulty paying for it. So this is the space around affordability. So even if you have technology, it can be difficult to use it. And we know that a lot more people use telehealth in the last year, but most people only used it on the phone. And that's for a range of reasons around confidence and skills, but it's also because actually using webinar software or FaceTime or those kinds of things takes up a lot of data and costs a lot of money. So that's a big significant issue that we have here. First Nations children as well. We've got that First Nations children are 21% of First Nations children are not likely to have internet at home. And again, that's a significant impact for those communities around being able to stay in contact. So what we know is that COVID exposed the digital divide, that it showed that people need digital to be able to stay connected, to have information and access to services, to have better health outcomes, as Helen's talked about, and to be able to just do the everyday things like shopping online. I'm coming to you from lockdown at the moment, and without the internet, it's very difficult to stay connected to people you love, to be able to get the right health information about what's going on, to even be able to download to log in and be able to get a COVID vaccination is very difficult if you don't have the ability to go online. So we're interested in doing this and fixing this digital divide, but doing it at scale. And that's why in Australia, just like in the UK, we've built a network of community partners all over Australia to try and address this. And as I said, we're very focused on building the capacity of community organisations to be able to deliver digital literacy programs in their community. So we have 3,500 community partners across the country now, and they're a real range of organisations. And I'm so sorry, my dog's going to bark right at this second. I'm coming from home, so I'm really sorry about that. That we have libraries, we have community centres, we have disability services, health providers, support groups. And I suppose what our focus is on is how do we build the embed digital inclusion and digital literacy programs into the work that people are already doing. Because these community organisations are already supporting people that are digitally excluded. So we want to be able to reach those people. And so building capacity in those community organisations is really the way that we see to do that. One of the main programs we've delivered has been called Be Connected, and that's a federal government program, and it's supporting older Australians to get online. And so over the last 4 years, that program has supported, it's actually closer to 1 million people now through those community partners and through an online platform that the eSafety Commissioner delivers. And it's really that opportunity to have localized support alongside quality online learning that talks about things like how to use a computer, what is email and how do I set that up? What is it all about if you're talking about safe passwords, etc. So it's really about building confidence of people to use digital technology in the ways that suits them and to improve their lives. And what we know from the Be Connected program over the last 4 years is that it certainly has increased people's digital skills. It's increased their confidence using the internet. It's increased their online safety, but it's also, most importantly, increased their social connection. And we know how important social connection is in ensuring mental health and wellbeing for people in the community. And just like Helen was talking about it in terms of the NHS program, Be Connected has created a social return on investment of $4 for every one. And that's really about the impact that those community partners have had in building that connection, not only building digital skills, but building connection amongst people in the community so that they feel more confident, not just to use the technology, but to be able to do the things that are important to them in their lives. So I think I'm going to hand over to Liz now to talk a bit more about our digital health program, because we've got this fantastic digital literacy program that we've been building. And then we know that to build health, we wanted to put that digital health literacy on top. So Liz, I'll hand over to you now.
Thanks, Jess. Thank you. And I'd just like to acknowledge the traditional owners from where I'm coming from today, which is on the Sunshine Coast, which is the Gubbi Gubbi people. And pay my respects to elders past, present and emerging. So yes, as Jess said, we've also then recognising the importance and now the kind of increasing prevalence of digital technology to access health information, use health tools, you know, whether it's telehealth or health apps, and this is increasing. It was really important to ensure that there's support available in the community for consumers to be able to use some of this great technology. And we're very pro technology, and I've been in the digital health space for many years now in Australia. So, but recognising that the risk is that there's an increasing divide between those that are able to use health tools and digital tools for the benefit of their health and well-being, and those that aren't, and you know, risking being left behind and experiencing worse health outcomes. So essentially we ran a program with the funding of the Australian Digital Health Agency, and we started it back in 2019 with a pilot and then rolled it out more broadly across 75 locations across Australia. And this was really to support consumers to use digital tools. So really looking up health information online. Where do you find reliable, you know, trustworthy health information online? A bit about then downloading health apps and using health apps, and also then use of My Health Record and understanding some of the privacy and security aspects that are really important in that. And so we ran it over a couple of years. We're hoping to continue that more broadly, but it really helped to provide support then again through each of those community organisations. They delivered it all in slightly different ways, because we provide quite a lot of flexibility in how they did that, but it really did have a positive impact on those consumers to be able to access health information online, and really gain some new skills and confidence in doing that. So we reached in total more than 6,000 people, and really kind of trained, specifically going through training programs with our digital health mentors, more than 3,000 people. Jess, do you want to, next slide, oops. And it's, you know, some of the results that we got were really fantastic. We had an evaluation done, and 92% increased their awareness of digital health resources and apps, you know, where to find that information. 79% then reported having greater access to that digital health literacy support within their communities, knowing where to go, who's able to support that. It did increase generally, kind of overall, the programme increased people's knowledge and confidence, I guess, in My Health Record and understanding it a bit more. And again, similar to the Be Connected programme, 92% increased their social connection, which is just such an important aspect of these programmes. It's really enabling people to connect either digitally or face-to-face with other people in their communities. So we're very excited to have that as a brilliant outcome. Next slide, please. This is a picture of one of our partners, our network partners that were delivering Health My Way. So this was Artworks Inc. And so I said that we gave quite a lot of flexibility around the way that people delivered the programme. And the way that this organisation did it was they were running art programmes anyway. And so it's around understanding where are people, what kind of topics are people interested in. So they would obviously cover art, and then also then they started to get more involved in mental health and the sort of benefits of mental health and art on mental health. And then it seemed a really natural progression then to also then build in the Health My Way, where it was then about, okay, well, where do you find this information online, and looking at kind of that broader health and well-being. So they brought that into the programme, and they had some really, really good results that way. So rather than necessarily just doing a formalized program on you're going to learn digital health skills, it was very much that interest-based learning approach, which we love so much and we really encourage our partners to do. Jess, do you want to next slide? And then also something we've been doing in the last kind of 18 months or so, and really this is in partnership with Australian National University, but bringing together a lot of organisations that are starting to recognise the impact that this sort of digital health divide is creating, and that really is, you know, there's groups that are getting left behind, and that sort of impact on their health and well-being if they're not able to use and access digital technology. And so a lot of that was about creating a community of practice, so that we can all kind of coordinate and collaborate on trying to improve this. And some of the recommendations that came out of that series, there's obviously a lot more detail that goes in underneath this, but at a high level, it was that there really does need to be support and education within the communities to develop the skills and confidence to use these different forms of technology. There needs to be reliable and affordable technology and connectivity to ensure that equity of access to digital health services. And also that healthcare providers, they still also need assistance and upskilling on using these technologies, including, you know, telehealth. And as it's such I guess a huge area of innovation and development, that, you know, there just needs to be that support available so that people can use it to the full benefit of everyone. So yeah, that was just a picture as well of one of our from our conference that we held recently, which was, and we had a panel session which talked about, can digital technology support good health and well-being? So there's some really nice little kind of capture of the conversation that we had there. Thanks, Jess.
Well, thank you very much to Helen, Jessica and Liz. That was really great. We've got lots of questions come in, which we will get to, and they're kind of grouping, and so we'll see how we go. But before we go there, I'd like to invite Sonia Markov to give a sort of consumer perspective on some of this. Sonia is a long-term consumer health advocate and was one of CHF's consumer commissioners for our Beyond COVID Commission in 2020. She's been a healthcare consumer for over 40 years, starting with a childhood cancer and now with several chronic illnesses. So she's seen all the good, bad and ugly of the health system, I think it's fair to say. She's committed to ensuring consumers and community members have a strong collective voice and a say in how services are developed and delivered. And to do that, she's been an active part of South Eastern Sydney's Health District committees. She's based in the Sutherland Shire, I think I'm correct in saying, and as a consumer rep with the Australian Digital Health Agency. This is Sonia's first webinar, so I'm sure everybody will be delighted to hear from you. So Sonia, have you got any reflections on what people said, or what would you like to start off with?
I wanted to say that I think that it's amazing that we've got this technology, especially in the recent pandemic. And I think it's amazing that it's getting out there to the community so that they can access and improve their health and well-being. So I think that's important. But what's important, it needs to be universal for everyone to be able to access it. You know, we need to build those bridges and, you know, keep defining those gaps so that we can make it a quality for everyone to have access to the healthcare that they need. So I think that's so important for everybody. Listening to all the different presentations has been amazing. From my own experience in trying to access technology, you know, via telehealth and others, it's been a challenging experience where I've had some doctors, you know, will use it, and that's fantastic. Where there's been resistance from other specialists and that, where they don't want to even have a bar of the technology. So it wasn't, you know, an option for me to access, you know, especially when you during the pandemic, I'm very housebound, like a lot of people, but more case when you've got chronic illnesses. So having access to telehealth and to be able to talk to my specialists about my health, it is so important. But it also, with those barriers, if we don't address them, like we've been talking through this webinar, those barriers and those gaps will divide the community, and consumers won't get the proper health that we need. So there's different points. I've also had, through all the different networks, some of the barriers that some other people face in, you know, where, as we said, clinicians have had resistance to this technology, not, you know, especially some of the older generation GPs, and other specialists not wanting to train and upskill on how to use it. Others haven't even gave it an option to their patients to use it. So again, that's creating that divide. But on a positive note on other things is that, you know, it's at least given an opportunity for all consumers to try and have access to this. And with all these programs and all these people advocating on all our behalf, we can try and build those and break down those barriers. But also it's important that clinicians need to take the time and listen to the consumer, build that empowerment with the patient so they can have a say in their own health care. They need to have, you know, with telehealth, that is a potential of building better relationships with their provider, with their GPs, making sure that they're getting their health needs addressed. It's also given them, you know, different communities to have access to it. But at the same time, you need to address those issues that we're doing through these types of different platforms. But if we don't, you know, but we all need to be on the same page of this. What's also important, that like the current issues that we're hearing, you know, is that we need to make sure that people know how to use the devices, how to access the various platforms, even down to basic computer literacy, also health literacy. Some of my different networks, that's one of the biggest issues among certain community groups, is that they don't have enough understanding, education on health literacy, as an example. And that is a very common issue amongst some of the cultural diversity groups. Are not, you know, for English is not their first language. Some of these telehealth are not written in their languages. There needs to be written in, you know, some of them. Even sometimes I've had consumers come back to me from some of these diverse groups to say that they couldn't even book an interpreter so that they could access telehealth. Some of them have used family, but that's not always the case because of contract. You know, the patient wants to have the choice and control on who is part of that relationship in their appointments, as an example. You know, like a lot of families don't always want their loved ones in that appointment. So, you know, and there's also some interpreters are not familiar on even how to access telehealth and some of these platforms. So there still needs to be a lot of more community awareness of what's been happening, and also making sure that other providers, other government agencies are building those gaps as well. Especially, for example, for people with disabilities, with mental health, other, you know, NDIS and the Digital Health Agency need to talk to each other a lot more, you know, because there's just so many gaps, because a lot of people reflect on using various services through those different platforms. I know myself, I do. And if I don't have the certain Ally Health or any of them not accessing this technology, then I wouldn't get my needs met. I can only imagine what other health concerns the families are facing. There's so many other groups, as we've discussed, the age in populating, even people being able to understand how to use it. There's so many different parts of the community that still need to have access to quality health care.
Sonia, I might go to ask you the first question, which actually came in, not on the chat, but came in prior, and then I'll go to the others. Have you had consumers say to you, oh, I can't be bothered, oh, I just don't want to do that? You know, we're talking about vaccine hesitancy. Do you think there's some digital hesitancy going on? And what was your response to people if they say that?
I can say that on a personal note, I've had that. You know, oh, why would you want to use that? It's better to go and see them. It's saying, well, what about, for example, for me, if I'm not well enough, I can't get through the door. I rely on that technology so that I can have that some type of face-to-face with my specialist, so that I can get my health care needs. Other people, I think sometimes it's addressing the fear of the unknown. If they don't know how or understand how it works, there builds that perception of those elements. And so I think it's just more community awareness about how to use these technologies, but having that access to it on the same time. So it's, you know, it's big, scary, but once you learn how to know how to use it, that's half the battle.
So I guess a lot of the work that you do at the Good Things Foundation is actually getting over that hesitancy. Well, you know, what do you think, what are the key ways of getting over that hesitancy? Jess or Liz or Helen, what do you think?
Well, I think, I mean, first of all, it's really about finding out what people want to do with their lives, right? So like with anything, it's about finding out what is the thing what's the hook we talk about? What's the hook that's going to help people find this an important thing to their lives? Now, actually, what we know from COVID is that that's changed for a lot of people, because people have been forced to have to use it for different reasons. And so people have gone, oh, well, it's something I have to do, right? But actually, one of the things we also know is that people are scared. So they're scared of not, as you said, Sonia, like they're worried that they're going to break the technology, that they're going to get scammed, that something bad's going to happen because they don't understand how to use it. And so for us, it's also about making sure that there's a whole lot of education around online safety as part of that conversation, because that's the bit that really puts people off quite a lot, is being scared that something bad is going to happen to them. And so it's really about saying, you know, like if you're learning to drive a car, then there's all of the things that you have to do to be able to be safe on the road, right? And so it's just the same when you're learning to be on the internet. It's like, what are the tips and tricks that you need to be able to do to make sure you can keep yourself safe? So it's like any new thing, it can be scary to start with, but it's also about having that support in the local community. And that's what our network is all about, really, is making sure that there's local friendly support for people to go and ask a question that they might think is stupid, or they might be feeling a bit unsure about something, but they can go and ask somebody that they trust. that will help them to work through that issue or that question, that problem. And so having that localized support is also really important. And mostly the digital mentors are often people like them. So they're not, they're not tech experts. They're not people that, are going to talk in some foreign language to them that they don't understand, because that's what technology feels like sometimes if you're new to it, is that, that they're going to help in that friendly way, saying, I've had this problem, or I've done this and this is what I did. So I think it's those three things. It's, getting over fear, making sure that we talk about online safety, and also making sure that there's that localized support from peer mentors.
Helen, did you want to add anything on that one?
I just wanted to emphasize the last point that Jess was making, because I think that having a local, informal, friendly place, and I think it's really important to emphasize this is not about super techy. This isn't all like, they're not, the digital mentors aren't, geeks who are going to like talk about technology and flabbergast you. They're people like you. I think that's the message, is that they're from that community, they understand people from that community, and often the people who are the best digital mentors actually didn't know how to use technology themselves 2 or 3 years ago. And so they actually are the ones that can really passionately talk about how it's benefited their lives. I think that, and they also can just say, just have a go. We can help you, have a go. You can go somewhere, you don't have to buy any technology, you can just come along and have a bit of a go with people like you. And then if you don't like it, fair enough, but you might as well have a go.
Yeah, that's good. I mean, that leads on to another question which has come through in several of the questions in the chat and in questions that were sent in previously, which is actually having the technology. We've talked a lot about people using it, being comfortable, but there are barriers to people owning a smartphone, owning a laptop. Jess, you mentioned some of it, cost and mobile data as opposed to any other form, and the ubiquitous NBN in Australia, which we all love. But, as part of your work, are you identifying ways that we can help people afford the devices and the access that way?
Yeah, look, I think, Helen, do you want to talk about the devices work that you've done, and then I can talk about what we've done here? Yeah. So
we done a lot of work around devices and around affordable internet in the UK. So but it's fair to say before the pandemic, we had done very little. We've done a few pilots here and there. What we now are advocating for is that everyone should be able to have a personal device. Also, actually, a lot of people that we work with don't know that that there are affordable tablets. Like an Android tablet, you can get one for $250 or something. And so we've actually had a program. We still are ongoing having a program where we give people who can't afford devices, we give them a device, and we've helped 22,000 people and families so far in the UK. And then on the advocating for affordable internet, we believe, so in the UK, what we're saying is that everybody on low income should have an affordable internet package, and everyone on very low incomes should have access to free internet when they need it at points of need and points of crisis. And we're doing really well on both of those fronts. On the free internet, we've actually set up a national data bank, which is like a food bank, but for data. And so all of our thousands of community organizations will be able to access free SIM cards with data preloaded and data vouchers for people who need that. So I think Jess is a little bit jealous of some of that work that we've been able to do, but we know that it's so important that people get that support, so they have the skills and they feel safe. So that isn't important, but they also need to have personal access to devices and affordable internet data.
Yeah, Jess? Yeah, so I am a little bit jealous of some of that work, but and we certainly did. We were able to give out grants to our community partners last year as a response to COVID. I suppose, previously we were working with community partners and we made sure that they had devices so people had a place that they could go to access the internet and to be able to practice and those kinds of things. But with, all of those centres having to close down, there was a huge need to make sure people were able to stay connected. And that's an ongoing need, I would say. But we had grants that we gave out to our community partners that enabled them to purchase devices to loan to people, and that's kind of the approach that we could do really quickly as a response. There have been other kind of some programs where people have been given devices, particularly in the space for children and young people who are learning online. There was a lot of kind of activity in that space in the last 12 months, but there's really no consistent approach to affordable internet in Australia. Our colleagues at ACAN, which is the Australian Communications Consumer Action Network, they just had their conference yesterday. They've been working really hard on a campaign called No Australian Left Offline, and that's all about affordable broadband and trying to get a consistent affordable broadband for all Australians, for low-income families and families and people, really. So I think there's still a bit of a way to go on that, but the NBN CEO was talking there yesterday, and he sounded quite positive about some of the work that they're doing. So we're hopeful that something will come out, but I still think it's still hard for people, and there's a lot of, it's hard to find the cheap options, and so it's all about information and making sure there's a consistent approach to that, I think, to make sure that everybody has access to an affordable device and the data to be able to use the internet.
Yeah. Sonia, you mentioned people from culturally and linguistically diverse backgrounds and people from languages, and there's quite a few questions about that in the chat. So, I wonder, Sonia, you identified some of the issues people had about not being able to get interpreters for telehealth and things. Do people also talk to you about accessing information and how it's not in their language, or that they don't know how to?
Yeah, that has been a constant issue across all the different networks that I've been involved in, is that it comes down to the basic. They don't know where to go for the information. Even sometimes they even down to like the actual family members who don't know where the access, they don't think to know. Even some of the consumers have said that even their GP hasn't been able to provide any literacy on how to use this. It's only the only option they've had is in English, not in the most common languages, like a lot of the hospitals do. They would put it out, or even know that they have the choice to have that. It comes down to the grassroots of everything, of not knowing where those resources are, how to access them, how to secure them, but at the same time, how to understand it. And we need to make sure that's on the ground running, because the most people that in some part of their life, they're going to access a GP. So the GP needs to, and the allied health services and all that, need to make sure that it's on the ground. And even your local community groups, like your community health centres and your local neighbourhood centre, need to have those informations there. That is, so that everyone can access those things.
So in terms of the Good Things Foundation, England, UK is very diverse. And Australia's getting there. I mean, and I think it was Liz in one of in some of the discussion, and in the slide you put up, Jess, about the groups that are disadvantaged. Did you find that people from culturally and linguistically diverse backgrounds were not participating in your My Way stuff or in your projects, or what's been the approach to get them involved?
I'm going to cover that one.
Yeah.
So absolutely, in terms of knowing that, they will be one of the key groups that are more digitally excluded, more likely, particularly new migrants and refugees as well, sort of obviously called as quite a broad group, but certainly new migrants, refugees are very digitally excluded generally. And we know that they're also more likely then to have, be on lower income, especially from that sort of lower socioeconomic status. And we know that they're more likely then to have the worst health outcomes as well. So, in terms of, they're one of the key groups that we need to be supporting the most. I guess the way that we approach it is, the way that we do our model is upskilling those people within the communities then that have those relationships and already supporting people from all the different types of communities. And so making sure that they're able then to provide those skills and training, which, and look, in reality, we did sort of 75 communities. It's nowhere near enough that we'd like to do, but, it's a good start. But by having that kind of, that peer-to-peer and that sort of localized support, that's how we aim to address it. So even if, our materials may not be in sort of, multiple languages necessarily, it's about then they can actually take that and then they kind of rework it and then, provide that support. Because a lot of people aren't able to read as well. We know that literacy is an issue. So very much that kind of verbal provision of information is really important as well. And there's so many concepts, I've heard it was very, very difficult during COVID for people from non-English speaking backgrounds to be supported via phone to then get online to do, Zoom conversations. It was, very, very difficult when just concepts like, mouse or, there's the sort of the language that we use online. There's no kind of direct translation, so it's very difficult to do that just by phone. So, that was a huge challenge really for a lot of our partners to be able to shift to that online delivery, whereas others were able to deal with that a little bit more easily. Those from a non-English speaking background, it was really challenging.
I would say, just to add to that, Liz, that for the Be Connected program, we do have like tip sheets in different languages of each of the courses, and so in like 8 languages, it's definitely not enough, but it is something. And just to support what Liz said in terms of our model, we have some fantastic partners that are, the Cultural Diversity Network and the Indo-Chinese Elderly Refugees Association, and they have their digital mentors are bilingual mentors. And so they work really hard at talking to people and upskilling people in their own language as well, knowing that that's the way that it needs to work. So I think, it's really important that we're involving the different cultural groups and the different organisations that support people from those different cultural backgrounds to be upskilled themselves, to feel confident to be able to do that work.
Helen, did you want to add anything?
Just in the UK, that we do a lot of work with people from the Indian subcontinent, India, Bangladesh, Pakistan in particular, that we have. So our Learn My Way learning platform has text to speech. So if you can't read it, so for whatever reason you can't read it, you can actually hear it spoken to you. And actually a lot of our community partners who are supporting people who are culturally and linguistically diverse are saying that they actually use it as part of their programs to support people to learn English. I think I just want to say that something statistically from I'm a bit of a data nerd from around different ethnic groups, is that we have really good data in the UK about who is digitally excluded, and actually just going back to the lower incomes and age as the 2 main factors. So those groups in the UK who are not typically in the low income groups, for example, people from Chinese backgrounds, are actually more digitally included than everybody else in the UK. So I think it's important not to make sure that we're focusing in the communities where there's the greatest need. And so that's really what our model is about.
I think that's a really good point, that we shouldn't just say put everybody into one basket, and because your approach is very community led, you're meeting the needs in those communities, which I think is one of its strengths. From questions that came in before, and from Sonia was talking about this, and several questions that come online, one of the issues has been consumers are upskilling themselves, but the health professionals aren't. This is a common complaint in Australia. It may not be the case in the UK, but it certainly is here. So are you doing work with health professionals? Have you flagged this with the Australian Digital Health Agency or the Department of Health or the colleges or somebody that this is something they need to get onto?
Yeah, to a degree. And look, I guess, you know, obviously the Australian Digital Health Agency is putting a lot of effort into and working with all the colleges and associations, the professional colleges and associations, you know, to provide that education, upskilling of the sector, the healthcare sector. However, we know that there are some groups, particularly that just have low digital inclusion or certainly low digital skills and capabilities. So particularly kind of the aged care sector and professionals working in that space. So a lot of the sort of human services, you know, supporting disability care workers as well. And we've kind of, I guess, found out more recently, even, you know, mental health services as well. There's a lot of I guess, concern there that, again, mental health services are increasingly going online and there's a big drive towards digitization. But yeah, we have to make sure that the professionals themselves are able to keep up. So it's certainly something we're looking at, and we're talking with a lot of groups about, and how we can essentially use the same kind of model to then support the workers and the workforce that are at that really low digital level of skills and ability, because I think there are the higher levels of skills is being introduced. That kind of digital health training is now being introduced into curriculum, and sort of the kind of professional development in those areas. But you're right, I think there's still also just some groups that are, or some, you know, particularly the older healthcare providers, that they're very resistant to getting on board, and you know, whether they will ever make the change, I don't know.
It's certainly a source of frustration for consumers. There we go. We're on Zoom. Family, dogs, cats. It's just life.
That's it.
We're almost out of time, so I think we probably haven't got time to go. But I'd like to just ask, starting with Sonia, if there was one thing that you would like to see improved in terms of digital services or people's access to digital resources, what would it be? You can go first if you want, Sonia, or you can wait. It's up to you. Would you like to go? You'll wait.
Get back to you. Thank you.
So, Jess, Liz, or Helen, if you had one thing, your top of your wish list for Australia, I guess, or top of your wish list generally, what would it be?
I mean, for me, it's more consumer education. It's really about making sure that people have the skills and confidence to be able to use digital health, but to use technology in the way that improves their health, whether that's for, you know, using health apps, or, you know, using my health record, or it's just being able to connect with family and friends to support their social connection. That's really the thing I think is most important. Yeah.
Liz?
I probably ditto in a lot of ways. I think just, you know, all of the work that we've done with our network and partners across the country, you know, I think there's a great will and desire to support their communities with digital health skills and confidence. You know, there's such a recognition that, and particularly since COVID, how important it is that people can use technology for health and well-being, and they, you know, they want to be able to support that. So I think it's just kind of enabling them to be able to do that, and providing some funding to support that.
And Helen?
I'm a fan of kicking it upstairs, so I think it has to be about leadership. I know that in Australia, at the federal government level, state government level, there are digital economy strategies, there's digital health strategies being developed, and absolutely digital inclusion's got to be such a big part of this. It can't just be about modern technologies, not even just about educating the workforce in the health sector. It's got to be about absolutely leaving nobody behind, and for that digital revolution in digital health to include every single Australian.
And Sonia, last word.
Last word, I think accessibility for all, and equality for all, to make sure that everyone has a chance of the best quality of life.
Excellent. That's a great note to finish on. And just quickly to note that we have an expression of interest out at the moment for people who would like to run kitchen table discussions about the National Digital Health Strategy. So if you go onto our website, we're happy to hear from people who'd like to participate in that process. I'd like to thank you all very much. I'd particularly thank the Sonia for coming on, and thank you for making yourself available. And I know it wasn't easy for you, so thanks very much. It was great. And thank you to the Good Things Foundation, and we look forward to working with you in the future. So thank you, everybody, and have a great afternoon.
Take care.
Thanks, Jo.
Thank you.
Thank you.
Bye.
Bye.